Welcome to Enduring Training for Directly Observed Therapy Workers. This is Lesson 9, Additional Duties. The learning objectives for this lesson are to describe additional duties that may be assigned to the directly observed therapy worker. So you're probably thinking, wait, DOT is one of my other duties as assigned, which may be the case, but remember, every DOT visit is an opportunity to see the patient and secure any other pending duty that may be needed for the patient or their contact's case management. Additional duties as assigned can be to provide education to the patient, collect sputum, draw blood, aid the contact investigation process, screen contacts, provide social services, and transportation services. I'm sure I sound like a broken record already because I've said so many times, but we need to provide good education to our patients at all times. This is the most powerful tool that we have for treatment completion. With good education, patients are able to make informed decisions which will result in better compliance. They may decide to share their diagnosis with their family, friends, and even coworkers. If they do, they're going to need your help. Teach them how to educate others about their disease. People will have questions for them. Help provide them with the tools that they will need to answer those questions. You could even serve as an audience for them so that they can get comfortable with the process. This is such a great way to make sure that the patient has understood all the education that you've been providing. They may also ask you to provide education to their family. This is not uncommon. You're the one that they see. You're the one that the patient's family sees for the most part on a regular basis. They will get comfortable with you, all of them. And they'll look to you for support and answers. Be sure that education is culturally appropriate and it's provided at an appropriate literacy and health literacy level. The CDC has a document entitled Simply Put. It's a guide for developing informational flyers for the patient. This is a great resource if you decide that you want to create something for your patient. Whenever you provide education, be sure to follow the KISS principle. KISS stands for Keep It Short and Simple. And be sure to repeat yourself often. Keep in mind that people learn differently, so be sure that you use a varied approach. Be able to provide reading material, a video as a resource, or something with pictures, etc. Like here, for example. I mean, seriously, how great is this He-Man picture here? A few tips for providing health education for understanding is to keep your message short. Stay away from jargon and technical terms. But if you have to use it, be sure that you explain them first. You'll notice that after the patient's been on treatment for a few weeks, they're usually with you in terms of the terminology. They'll start to call the medications by their proper name, and they'll start talking to you about their sputum or using other sort of technical terms with you. But you have to wait for them to get to that point first. Don't just jump right in. Be sure to provide information in chunks and present it chronologically. Be specific about what it is you want them to do. When you say that you're going to bring them their medication, that could literally mean that you're going to bring them their medication. You're just going to drop it off. So, be sure that you say, I will be stopping by to give you your medications and see how the medications are treating you. Once I see you take your medication without any problems, I will be on my way. That's more specific and to the point. Be sure that you personalize it. Make sure that the information is relevant to the patient. If you have a patient who has extrapulmonary TB, maybe they have TB in their eye, don't talk to them about pulmonary TB. Unless they have a genuine interest and they want to learn more about tuberculosis. That's a different way that you can connect with the patient by providing them information. That helps to build rapport. But we want to be sure that they get the message about their specific disease first. People like to do their own research. We live in an era where people Google their symptoms before they even go to the doctor. And then they go to the doctor, they get diagnosed with something, and then when they go home, they Google their diagnosis. But it's important to be aware of misinformation. There is a lot of information out there. Some of it is good and true, and some of it is bad and untrue. If you don't provide the patient with reputable websites for them to read up on their own, they'll just start to look and search the internet on their own, and you never know what they're going to come across. There are many sites out there that claim that TB can be cured naturally, with no symptoms, and in no time at all. That definitely sounds a lot better than having to be treated for 6 months by harsh medications by DOT. So be sure to provide them with the reputable sites, like the CDC. You can also give them the web address to your program's website, or other similar state website. You can even provide them with links from vetted websites for them to look into. I would also caution them that there are sites like this one here out there, and explain to them that these are not factual. Here are some examples of reputable websites. It's nice to be able to provide the patient with links to other health departments, either within your state or your neighboring states, so that they can see that everyone's treating TB in the same way. Sometimes you'll be asked to drop off specimen collection supplies, pick up a specimen the patient has already collected, or aid the patient in collecting a specimen. The first is the easiest one, because you literally are delivering the supplies and explaining the process. When collecting a specimen, be sure to verify that the specimen has the patient's name, date of birth, and date and time of collection. Specimens should be kept in the patient's refrigerator and then transferred to your ice chest so it remains cold until delivery to the clinic, where it then will be returned to the refrigerator. If you're asked to aid or observe a specimen collection, be sure to do this outside if possible. If you are inside, be sure that you do this near an open window, away from the direction of the airflow, and that your mask is on and that you've done a good seal check. Provide instructions and coach the patient on producing sputum. I've included 3 videos here. The first one is a good instructional video for the patient on how to collect sputums at home. This is something you could show to the patient when you're dropping off their supplies.
Video is to show you how to provide a sputum specimen that was requested by your healthcare provider. Sputum is the mucus you cough up from your lungs. We need this sample to help find a cause for symptoms you're having, such as a fever, cough, or other breathing problems. Even if you aren't feeling sick at all, your provider may still want to make sure that you don't have tuberculosis or another infection that can be spread to other people. The sputum sample you're providing will help figure out the cause of your symptoms or infection, help you get the correct treatment, and help prevent any infection from spreading to others. First, let's get clear about just what sputum is. Sputum is mucus coughed up from deep in your lungs. Normally, it's thick and clear, but if you have an infection, it can be different colors such as white, green, or yellow, and it may have red or brown blood in it. Sputum is sometimes confused with saliva, but saliva is different. Saliva is in your mouth, not in your lungs, and it's a thin, clear, watery liquid. In order to diagnose a lung infection, the laboratory needs to have a sample from where the infection may be. So it's important to have sputum from deep in your lungs and not saliva from your mouth. So please do not spit saliva into the specimen cup. Since most people don't cough much while sleeping, mucus tends to collect in the lungs as you sleep. This means there's more sputum available to cough up when you wake up. So the absolute best time to get a sputum sample is when you wake up. So let's see how it's done. Here are a few easy steps to make sure you get a good sample. First, get your supplies ready before you go to bed. Put the specimen cup and biohazard bag you were given, along with a pen, near your bed before you go to sleep, so everything is easy for you to find when you wake up. When you do get up, use the bathroom if you need to, and make sure you wash your hands afterwards. But do not brush your teeth, use mouthwash or toothpaste, or eat or drink anything. These are things that could contaminate the sample, making it useless. Now open the specimen cup. Set the lid aside so the bottom of the lid is facing up, which protects it from getting dirty. Be careful not to touch the inside of the cup or lid. This cup is sterilized, which means it's been specially cleaned to get rid of any dirt or germs that might contaminate the sputum sample. The next step involves getting ready to cough. Sitting and leaning forward is the best position for a good strong cough. Getting a good deep cough when you don't have the urge to cough involves a technique called huff coughing. To do a huff cough, you need to deliberately, quickly, and forcefully breathe out, making a huffing sound. Here's how the whole process looks and sounds. Now, let's watch each of the 5 steps of the process. The first step is to clear your lungs. You do this by taking a small breath in and then a gentle breath out. Do this 3 times in a row. The second step is to take a deep breath in, then let a gentle huff cough out. Third, take a fast, small breath in, then a gentle huff cough out. Fourth, repeat this fast, small breath in with a gentle huff cough out. Finally, the 5th step is to take a deep breath in, then a single, strong huff cough out. This final cough is when you should produce a good sputum sample from deep in your lungs. Once you've coughed up the sputum, carefully spit the sputum into the specimen cup. Your healthcare provider will show you how full the specimen cup should be for a good sample. Please remember, you need to produce sputum, not just saliva. Now, let's watch the full huff cough sequence one more time. Once you have a good sample, put the lid back on the specimen cup and write your name and the time and date on the label. Then place the specimen cup in the plastic biohazard bag and store it in the refrigerator until it's taken to the lab. Your healthcare provider will often need 3 sputum samples collected on 3 different days. Please use this same technique each time. If you've tried this technique a couple of times and still can't produce a good, deep cough with sputum, let your healthcare provider know. Collecting a good sputum sample will help make sure you get an accurate diagnosis and proper treatment as soon as possible. Thanks for watching and good luck with the procedure.
The next video shows the huffing cough, which aids in producing mucus.
Huff coughing is the next example. This is similar to the double coughing. We're going to take in a slow, deep breath through the nose, then hold for a count of 3, and then perform short, quick, forced exhalations with an open airway. It may help to use or whisper the word huff as you're doing it. It'll look like this. Again. And in the case of secretion movement, you're going to get behind those secretions and move them up. Multiple huffing with each breath.
And the last video shows the kids can be taught how to cough too.
Today, Emily is going to show you her technique for the huff cough. A huff cough is one way to remove mucus from your lungs. Sit with your back straight so you don't slouch. Next, begin by breathing through your nose and out through your mouth. Do this 2 times. On your third breath, inhale deeply through your nose and hold it for 2 seconds. To exhale, breathe out hard while making the sound hoo. If you are able to move some mucus out of your airways, you will feel the need to cough to get the mucus the rest of the way out. Repeat this process if you feel like you still have some mucus in your lungs. It's handy to have tissues with you while you're doing the huff cough. As you practice, it will become easier to do. Now Emily will show you this process a second time through.
Thanks for watching.
On rare occasions, you may be asked to draw blood for labs. When collecting blood in the home, be sure that you have a clean, hard surface with good lighting, space for you, the patient, and the materials, and an area free from potential hazards. Like, make sure that a cat isn't going to jump into your workspace or anything. Specimens should be labeled with the patient's name, date of birth, and specimen collection date and time. Be sure that you have all of your supplies before you start working. In fact, if you know that you're going to be tasked with collecting blood, either for labs or for TB infection screening, be sure to do a check of materials prior to leaving the office. You will need to include paperwork, a biohazard bag, gloves, Band-Aid, a tourniquet, a test tube, gauze, a poly towel, alcohol pad, needle, and a biohazard sharps container. You'll also need to be sure to have access to a trash can. As a DOT worker, you will have the closest relationship with the patient and the patient's family. You will oftentimes see them on a daily basis. They may share with you in conversation their activities and comment on visitors, both past and current. They may leave clues about visitors that are important, especially during the infectious period. They may even know where to find a contact that you've been unable to locate. A contact investigation is a strategy for identifying TB exposure and transmission in an effort to prevent future cases of TB. Patients who have been diagnosed with infectious TB are interviewed so that contacts can be identified. Contacts should be evaluated and treated if they are found to have tuberculosis, infection, or disease. Contact investigation is the second priority in TB elimination strategy. A contact is defined as someone who has been exposed to M. tuberculosis by sharing airspace with the person who's been diagnosed with infectious TB. You may be asked to screen contacts that are in the home. This should be done using a TST or IGRA, whichever has been designated as a preferred test for this group. Be sure that you have all the necessary paperwork and supplies prior to leaving the clinic. You may also be asked to read a skin test that was placed by a staff member in the office. Be sure to follow your program's policy on reading a skin test that was placed by someone else. Do not, however, offer to read a skin test of a contact that was placed by someone outside of your organization, like a primary care physician. Aiding the patient in securing social services is a great way to build rapport and remove potential barriers to treatment. Be sure to check in with your program's policy on securing aid for patients. There might be a preferred system in place for such services. If the patient has little to no access for food, try to locate a Meals on Wheels type program that can deliver food to the patient. Locate a food bank that will provide you with a box of food that you can take to the patient during a visit. For patients with potential housing issues, work with the patients and the nurse case manager to try to find support programs that will aid in rent and utility support. Sometimes these services require the person to complete forms in order to participate. If the patients are unable to complete the forms, you can help by reading or completing the forms for them. Addiction and recovery support. Here's a short video about Lisa. She's struggling with addiction, and her DOT worker is trying to support her.
Lisa is one of 3 characters in our story who have been placed on DOT. She is a 27-year-old single woman who works odd jobs and has struggled with marginal housing and drinking. When Lisa's DOT started, Terry, her public health nurse, had a long talk with her about TB, the importance of finishing her treatment, and what barriers to adherence she might anticipate. At first, Lisa seemed motivated by the incentive offered: fast food coupons for each week with no missed doses. Things went well the first 2 weeks, but during the last week, Lisa has missed 3 scheduled doses. Lisa couldn't be found in her usual single-room occupancy hotel. Terry finally tracks Lisa down at her sister's apartment.
Lisa, it's really good to see you. How's everything going?
No, I've been better. Sorry I haven't been around lately.
I've been concerned about you. I went by the hotel and found out that you weren't renting the room anymore.
Yeah, I broke up with my boyfriend, so I can't afford to rent that room by myself. So I've been staying here at my sister's house.
That sounds really hard. How's the drinking going?
Well, I've been feeling bad lately, so, you know.
Yeah, it's really hard. Break up with your boyfriend, not have a place to live, and if your TB gets worse, you'll feel very bad then. And I know you told me recently that you were really proud of yourself for being sober for 4 straight weeks.
It's just too much to deal with right now. My sister's all mad at me because I'm drinking again. The TB pills are the last thing on my mind. Plus, I'm not coughing anymore, so I really don't need them anyway.
You may not be coughing right now, but you need to finish the full course of your TB treatment, or else your TB will get much, much worse. And I'm sure that you don't want to go back into the hospital again. Things are hard right now, but what do you think we can do to get you back on track?
Well, if I settle down and quit moving around for a while, and if I get sober, my sister will probably let me stay here.
Well, we can set up an appointment at the Alcohol Treatment Center. Do you think that you would go back and attend the sessions again?
I guess I could give it a shot. I really like that one counselor I had before, Ronnie. But I don't know how I'd get from here to there every day anyway.
Well, I probably could get some bus passes for you, and maybe if I used your sister's phone and call Ronnie right now, we could make an appointment.
Okay.
Okay, great. Okay, Ronnie, thanks. See you then. Bye-bye. All right, you're all set for 3 o'clock with Ronnie tomorrow. Now we have to get back on course with the TB medication schedule, so you can cure your TB and we don't spread it to anybody like your sister. So what's going to be a good time and place for us to meet?
Do you want to come back here every day around noon?
Noon is good. And I brought today's dose with me and your favorite juice for helping to wash it down.
Oh, you think of everything.
Yeah. So I'll be back here tomorrow at noon, and I'll bring bus passes with me for getting to the treatment center. And there's just one more thing. Lisa, if you do move again or you go someplace else, please call me anytime. really let me know, and I'm just happy to meet you any place. And I'm really glad that we're getting back on course.
Me too. Thanks.
Some programs provide transportation services for the patient to get to and from the clinic for their appointments. The patient may still be infectious for some of these appointments, so it's important that you apply good infection control practices, which include use of an N95 mask for the healthcare worker, use of a surgical mask for the patient, and maximum amount of outdoor air to circulate in the vehicle. So a little homework for you. Get with your program manager to find out if there is a standard educational packet that is provided to the patient. Find out what educational resources are used to provide education to the patient. Ask about your program's policy on securing social services for the patients and the role that you may play. Ask about your program's policy on providing transportation services for the patient to get to and from the clinic. Ask your program manager what additional duties you may be asked to do in your role as contact investigator. The list that was included here is not an exhaustive list, so ask what other duties may be expected of you in your role as directly observed therapy worker. Thank you.